Welcome back. Let's discuss constipation, and we'll do so in two frames. One, quick relief strategies, because I completely understand, especially as a clinician, people needing relief quickly, but also simultaneously people wanting to resolve the underlying cause of the constipation. And because some of the causative treatments take a month or two to take full effect, this is where a pairing of quick relief along simultaneously with causative factors, I feel is the best way to frame this and to approach this. And also the model through which I think about constipation causatively involves four factors: insufficiency, bacterial overgrowth, structural, and gut-brain. And we'll define and outline and detail what the corresponding treatments are for each one of these. Now, as we start the discussion on constipation, you probably know some of the negative consequences of constipation. Toxins can build up. The straining can be damaging to the pelvic floor. It can also cause hemorrhoids. And there can additionally be just this sense of being uncomfortable, almost psychologically, beyond the gastrointestinal feeling of being uncomfortable. I think people are emotionally sometimes a bit distraught when they're not moving regularly. So certainly with people on all of those feelings, and thankfully there is quite a bit we can do to help improve these things. Defining constipation would be 3 or less bowel movements per week, or a hard time with movement, sometimes probably better described as incomplete evacuation, or taking a long time to pass a bowel movement. And again, thankfully, there's a lot that we can do here. So let's start with the quick relief strategies. There's many of them. These are the few that I think make the most sense. Magnesium. There's different forms. There's citrate, which I favor. There's oxide. Irrespective of the form, again, I would favor citrate or oxide. Magnesium is going to pull water into the bowel and function as a laxative. The way to use magnesium in this application would be titrating or gradually increasing your dose until you notice a bowel movement. So magnesium or even vitamin C, with a gradual incremental increasing of the dose, will have a laxation effect. Starting off with maybe 300 milligrams of magnesium, and then you can double to 6 and double to 9. When you hit that appropriate level, you'll know it. The one downside potentially of magnesium is that you can overshoot the landing and go from constipated to looser bowels, but at least this is something to get you moving. Senna and aloe are also other options that can be used to help with regularity. And with senna, the dosages are 15 to 30 milligrams once to twice per day. And with aloe, anywhere from 500 to 200 milligrams per day. Now, with senna, some have claimed that you should not use this long term. I don't know that I would agree with that based upon Leonard Weinstock's podcast interview, now going back maybe 5 years, as a gastroenterologist who was looking via colonoscopy at the lining of colons of some of his patients who are on senna long term. He did confirm that you'll get some of this melanocytosis or darkening of the colonic wall, but he didn't feel that posed any risk. So I would say with senna, longer term, if it's being used as part of a comprehensive approach, and even with all the other causative supports that we're going to discuss more in a moment, you're still noticing you need some senna, I would side with Weinstock on this in that it's probably okay longer term. This takes us through the quick relief strategies. Again, there are others. I think these are just if you need to get some quick movement: magnesium, senna, aloe. We could also even add to this Miralax, can get you moving kind of quickly. There's a number of them. I don't want to spend too long here because it's really the causative factors that I want to get to. And I would just quickly ask you to comment and subscribe. Your support has a very palpable impact on our channel's ability to reach and to help people. So any help is greatly appreciated. Okay, so coming to this causative model, the first one, insufficiency. Insufficiency of water, fiber, and movement. Now, regarding water, There was a very interesting meta-analysis just this year, 2024, from Alice van der Schoot, I hope I'm pronouncing her name correctly, from King's College. They looked at just under 800 people, and they had them do one of two things: drink more regular water, 32% response rate or noticeable improvement in constipation. So don't forget the importance of water, because sometimes with your normal diet and the fiber therein, if there's not enough water, that fiber that will soak up water can become like a dry sponge stuck in your colon. And this is why adequate hydration helps to moisturize that sponge and allow it to keep moving. So don't forget how important just this simple water consumption is for regularity. Now, the other group, what did they do? They drank 15 to 30 ounces per day of mineral water, and they had a 46% response rate in their constipation. So 32 versus 46. So if you wanted to go a step further with your water consumption, try mineral water, again, 15 to 30 ounces per day. Now, the other one is fiber, and fiber can be a little bit more of a hit or miss with people. If a higher fiber intake flares you, it could be that you're not drinking enough water, and that's the first place you want to go. However, it could also mean that you have this other causative factor of bacterial overgrowth, because fiber feeds bacteria, and some people have too much bacteria or imbalanced bacteria, and feeding that bacteria can worsen their symptoms, including their constipation. But nevertheless, adequate dietary fiber intake is going to be helpful for a fair subset of people. So increasing dietary fiber is one thing to at least trial. And here is a list of foods in ascending or increasing fiber content. Whole grains, quinoa and barley have 5 grams of fiber per cup. Vegetables like broccoli, Brussels sprouts have 5 grams per cup. Also, fruits like avocados and raspberries have 10 grams of fiber per 1 cup. Flax seeds and chia seeds have 10 grams per 1 ounce, and legumes like lentils and black beans have 15 grams per 1 cup. And you're aiming for 25 to 30 grams of dietary fiber per day. There's also supplemental fiber. For some people, especially if you have food sensitivities and you're saying, well, I'm somewhat restricted and I'm still working out what I can eat, what flares me and what doesn't flare me, then you may want to consolidate to a supplement so that you have a little bit more control over the dose and the delivery vehicle. This is where there is pretty compelling data, namely a 2022 meta-analysis on psyllium, where the consumption of psyllium increased bowel movements by 3 additional bowel movements per week. So let's say at baseline, you're someone who's moving your bowels 3 times per week at baseline, then you could go from 3 to 6, so pretty much every day. That's a pretty nice outcome. Psyllium or modified citrus pectin, these two are the most effective fibers for constipation. And somewhat routinely at the clinic, we'll have people trial pairing psyllium along with modified citrus pectin. In fact, this is something that I do daily, not that I'm constipated, but just to help with binding of toxins, with sort of keeping things moving. So something there to think about regarding dietary or supplemental fiber. There's also potentially insufficiency of movement. We've discussed on the podcast in the past that when you move, your stool moves also. And this is probably then not surprising that a 2019 meta-analysis found that aerobic exercise or walking improved constipation. The participants did need to hit a minimum of 2 hours of either walking or aerobics per week to have the effect. I'm also not claiming that aerobic training is better than resistance training for regularity. It's just this study was summarizing data that looked at aerobics and walking. My view is that any form of exercise should help with regularity. And you could even make an argument, and this sort of foreshadows the structural piece, that if you have an anatomical abnormality of your intestinal tract, things where you're bending and flexing forward can help to pump and massage the stool through. Just a few things to think about regarding insufficient movement and how important that is. One thing that may come up as a question is, well, what about insufficient enzymes? I've heard that enzymes are important and people supplement with all sorts of digestive enzymes. Should I do this if I'm constipated? Maybe, but what tends to happen in something like exocrine pancreatic insufficiency, EPI, where someone has a diagnosable insufficiency of pancreatic enzymes, is they have bloating, looser bowels, or diarrhea. So more commonly, what you see with enzyme insufficiency is diarrheal rather than constipative. Now, that being said, bile, which is sometimes in these enzyme supplements, can be a laxative. So some people may have noticed benefit from taking let's say it's a blend of pancreatic enzymes with bile, not because they necessarily needed the enzymes, but because, again, bile can function as a laxative. In fact, there's a condition known as bile acid diarrhea, where when people have damage to what's known as a terminal ileum, the last section of the small intestine, that is supposed to reabsorb a bile and not allow it to get into the colon, when that isn't working and the bile gets into the colon, you have, bam, bile acid malabsorption or bile acid diarrhea. So it is possible some people are sort of self-medicating, if you will, with bile, which they may not need. It may be helping them, but we may want to think about the other causative factors. And this actually ties in nicely with the next component of this, which is bacterial overgrowth. One of the things that bacterial overgrowth does, coming to the second factor in our causative model, is it deconjugates bile, making it harder to reabsorb, thus making it more prone to causing bile acid diarrhea or bile acid malabsorption. So with bacterial overgrowth, this comes back to my point before about some people will notice when they eat more fiber, they feel worse. Now, again, that could be you're not drinking enough water. So you want to make sure to be simple at first and make sure you're drinking adequate water. But if that is not the case, if you feel like you're adequately hydrating, then, and this would be maybe 8 to 10 glasses of water per day, I think is a good aim. Some have said drink half your body weight in pounds in ounces of water. So a 200-pound person would drink 100 ounces of water per day. I think that's also reasonable. If you're drinking enough water and you're still noticing that fiber, I have a bunch of salads, I have broccoli, I eat more fruits and vegetables, generally speaking, and I feel more bloated, more backed up, it could be that you're fueling a existing bacterial overgrowth. And this is where the low FODMAP diet has a ton of merit. Sometimes dietary changes are looked at as difficult, and I think this largely depends on the framing you bring to the conversation. If you're ever trying to do a diet to perfection, it will be difficult. The good news is that for the most part, you don't have to be 100% compliant, but rather 70, 80% compliance is enough to really move the needle, or in this case, move your bowels. So you may just want to do a quick audit of the fruits and vegetables you consume, moving away, so not exclusive elimination, but just moving away from high FODMAP toward lower FODMAP. And here's a quick juxtaposition. High FODMAP would be, in terms of fruits, apples, grapes, and watermelons. You want to swap those out for things like blueberries, strawberries, cantaloupe, and oranges. With vegetables, high FODMAP would include asparagus, broccoli, cauliflower, garlic, and onions. Swap those out and replace with kale, spinach, and carrots. And then finally, regarding grains, avoid whole wheat bread, barley, and rye. These are all high in FODMAPs, and replace those with oats, quinoa, or brown rice. This would include rice breads. 2 follow-ups on this. One, we have a food list if you wanted to get the deeper dive on what to eat and what to avoid. The University of Monash has an app if you want even more guidance. But secondly, regarding wheat, rye, and barley, I strongly suspect that there is probably a majority subset of people who have cut out wheat, rye, and barley and improved symptomatically, thinking it's because of the gluten, but it's actually because they've reduced their FODMAPs. The reason why this matters so much is because it's been fairly clearly and robustly demonstrated that FODMAP intolerance improves over time. So if you've cut out gluten and you felt better, don't automatically assume it's due to the inflammatory or allergenic component of the gliadin proteins. It might be the high level of prebiotics or FODMAPs in the gluten that you cut out that is responsible for the improvements that you're seeing. Thus, you might be able to reintroduce successfully. So continuing within bacterial overgrowth, we can also fight fire with fire, so to speak. Probiotics, even though they are bacteria, except for Saccharomyces, which is actually a fungus, so it's one type of probiotic. But for the most part, probiotics are bacteria. Yet, probiotics are also potent antibacterials. There are numerous clinical trials showing that probiotics can treat successfully SIBO. In fact, some systematic reviews comparing the antibiotic rifaximin against probiotics show equivalency, roughly 50% response rate or resolution rate, either using the antibiotic rifaximin or using probiotics for bacterial overgrowth. But what about regularity? What about constipation? That's what I really care about. That's why I'm listening to this podcast, watching this video. There are also numerous clinical trials that have found various types, or as we call them, categories of probiotics improve constipation, even going so far as meta-analysis level data showing that probiotics improve constipation. Thus, we come to the evidence-based meta protocol we've been developing for years now. You have 3 types of probiotics, blends of lactobacillus and bifidobacterium. Your dose there, 1 to 50 billion CFU per day. Or you have a fungus, Saccharomyces boulardii or Saccharomyces cerevisiae, dosed at 10 to 15 billion or 4 to 8 billion CFU per day, respectively. And then finally, the soil-based probiotics, these are bacillus species, generally speaking, 2 to 6 billion per day. And the duration here comes back to a point I made earlier. Some trials have found that you will not see a response in constipation until the 2nd or 3rd month. So it might be a little bit of a latent impact. And perhaps what's happening is as the probiotics are fighting the bacterial overgrowth and reducing leaky gut, it takes time for those impacts to then generate an improvement on motility. Thus why it may take 2 to 3 months to see a full response from the probiotics. If you do have bacterial overgrowth, you've probably heard of antimicrobials. And coming back to rifaximin, the antibiotic, there was a really seminal paper by Jerry Mullins, who is at Johns Hopkins, comparing rifaximin, the antibiotic for SIBO, against herbal antimicrobials. And I'll just quote, "Herbal therapies are at least as effective as rifaximin for resolution of SIBO." You can use either tool, just wanting to make the point that while the research here may be a bit more nascent compared to drug and pharmaceutical funded research, there is still exciting preliminary data. You're often going to see oregano oil, peppermint, black walnut, olive leaf, and or berberine. And I'll also share the data from our clinic. This is going back plus 5 years, and we finally analyzed this data, and it's currently in peer review for publication. So hopefully it'll be published Q3 of 2024. But essentially, we used 2 different approaches of herbal SIBO treatment, and we documented about a 40% resolution rate of SIBO breath testing with either approach. So the good news there is whether you're using something more fancy, herbals plus biofilm, degrading agents, or just herbals alone, you're looking at about a 40% response rate, which is fairly consistent with the other data on rifaximin, about a 50% resolution rate, or probiotics, about a 50% resolution rate. So looking at multiple data points, you're seeing, roughly speaking, about 50-ish% resolution rate of SIBO or bacterial overgrowth with these various tools. Another protocol or approach that I'm actually excited about, and we came across recently, thank you, Allison Seebecker. And if you want to see the recent interview with her, this is where she introduced what originally came from Dr. Kathleen Janelle of using a high dose sulfur, MSM, methyl sulfonyl methane, for people with bloating, distension, and constipation. There's no published research here, at least to my knowledge. This is purely clinicians in the trenches experimenting and reporting what's working. Now, the challenge here, the huge challenge here potentially, is bias, right? If you're a clinician and you're super excited about this protocol, there's a number of things that can confound, your read. You might be putting someone on low FODMAP, magnesium, probiotics, and this sulfur protocol. And if you're not careful with your diligency, you may then say, oh my goodness, look, this MSM protocol was super effective for constipation, but you didn't factor out the other interventions. So we do want to be cautious with this. However, great news, and a thank you to friend and colleague, Dr. Alana Gurovich, who's also been on the podcast in the past. She has tested this and verified she's seeing efficacy. And so this is something that we're starting to experiment with in the clinic ourselves. The protocol goes as follows. You start with half a teaspoon of MSM, and you gradually increase up to 2 tablespoons per day, which would be 30 grams. You stop after 2 months, and if your symptoms return, you can go back onto a half a teaspoon. So new protocol, something to consider. So we've talked about bacterial overgrowth, and we've also talked about some of these structural abnormalities. For both of these, my view is that an elemental diet is another tool that can be helpful, especially for bacterial overgrowth. There's the hallmark study by Mark Pimentel and colleagues that found, I believe it was about an 80-ish% resolution rate of both a SIBO breath test and IBS symptoms when using an elemental diet. An elemental diet is a meal replacement that is liquid, and it is very, very almost no fiber or prebiotics. What this does is it starves overgrowths. So if you do have a bacterial overgrowth, one of the ways that you can help remedy that is by this liquid medical food, if you will, that can starve overgrowth. And without going too far afield here, I think a practical way, a simpler way of using this is not to do what Mark Pimentel did, which was 2 weeks exclusively. My view is that's too high of a bar, but instead we can use it as a reset. 1 to 4 days in duration seems to be enough to quell symptoms and get most people moving. So you do it generally, mostly exclusively 1 to 4 days. And then from there, you can replace 1 or 2 meals per day. What's my evidence for that? A drove of clinical trials in inflammatory bowel disease showing reduced inflammation and reduced disease activity when using the elemental diet to replace roughly half of one's calories per day. Another thing that we should just touch on briefly underneath sort of the umbrella of bacterial overgrowth is motility and autoimmunity to the motility apparatus in the gut. You may have heard this post-infectious IBS syndrome, where someone has a bout of food poisoning or traveler's diarrhea. That acute episode clears, but in the wake of that, people have residual symptoms ongoing. And what can happen here is that initial bout of acute gastroenteritis or food poisoning then creates an autoimmune attack against the motility apparatus in the gut, and this can lead to IBS and bacterial overgrowth. What is interesting is that the people with constipation don't tend to have the autoimmunity. So the autoimmune hypothesis doesn't fully account for constipation. But what we can take away from this that is helpful is a prokinetic. Prokinetics are one proposed treatment for that autoimmunity. But putting that aside, if we look at people with constipation who were not responsive to laxatives or to dietary and lifestyle interventions, one of the most effective therapeutics is Resilord, aka prucalopride. So this is a pharmaceutical prokinetic, but for some people, again, who haven't responded to these other therapies, this is something to speak with your gastroenterologist about. It's more expensive. Insurance doesn't cover it as much, which is why there's usually firstly use something like Linzess, these pharmaceutical laxatives and stimulants, which can work, but some people watching this or listening to this may have been in the situation where it works, but it works too well. Now you have bowel urgency, now you have diarrhea, and it's hard to get the dose just right. So I'm open to all of these, but prucalopride seems to have benefit without having the side effects of some of these other stimulant laxatives. Okay, so now we come to structural abnormalities. This is important because for some people, the issue is not insufficient water, insufficient fiber, insufficient movement, and it's not necessarily bacterial overgrowth. It's that they have altered anatomy in their gastrointestinal tract. Let me take a step back. If you have altered anatomy, you can have these what's known as tortuous points in the colon. And for those of you watching this, that's what you're seeing here, but I'll also narrate it. You're seeing a few different images of the colon. On the left side, the colon appears normal. Then, as we move further to the right, the colon becomes more tortuous. All this means is you have these turns, these inflection points, sometimes known as redundancies, where food, or in this case, sort of stool, can get stuck. One of the ways to remedy this is perhaps exercise, like I mentioned earlier, that can tort the intestinal tract and kind of pump the stool. But another is this abdominal self-massage technique where you go from the lower right up and you just trace along ascending colon, transverse colon, descending colon, rectum. And that's what you're seeing in this other diagram. Essentially, very simple. You start lower right, you come up, you go across, you go down, and this helps push stool past these inflection points. Now, hang on a second. Is this just all theory? No. And surprising to me, actually, admittedly, I didn't think you would see such results from abdominal massage, but a 2023 meta-analysis, 13 randomized controlled trials, a little over 800 patients found that yes, abdominal self-massage is efficacious, effective for constipation. Quoting, abdominal massage therapy for functional constipation has certain clinical efficacy. So this is something to definitely bear in mind, because if the issue in your case is this tortuousness of the colon or redundancy, then you want to make sure to support this and not just keep hammering with antimicrobials or laxatives, high-dose magnesium, senna, what have you, because the problem might be structural. Now, this can also happen with the formation of scar tissue. If you've had abdominal pelvic surgeries or you have an inflammatory condition, let's say like inflammatory bowel disease, then it's possible that there's scar tissue that's impeding and occluding on the lumen, causing these stick points. And this is where Larry and Belinda Wern of Clear Passage, who have also been on the podcast, have published some really fascinating research that shows a manual therapy that's quite intensive, but nevertheless can break down with this very sort of specific massage or manual therapy technique scar tissue that can cause these impingements. They've also even shown this in infertility if there's an obstruction in fallopian tubes. So just bear this in mind that structural can be an issue. I've also put underneath the umbrella of structural mistiming of some of the muscles in the structure, if you will. The way this was best exemplified was by Dr. Satish Rao, also on the podcast a number of years back. He described it as this. If your rectum is a tube of toothpaste, you want the cap muscles to relax and the tube muscles to squeeze. But in some people, there's altered coordination. The cap stays squeezed, and the tube is flaccid and doesn't contract. And this is where biofeedback therapy can be quite helpful. If you're someone who feels like it's really hard for you to relax, this might be where the poop chair partially comes in. If it just feels like, okay, I'm going every day, but it's really hard to go, and I don't feel like I have full passage, biofeedback therapy might be what you need to rectify the cap and tube muscle coordination. If constipation started post-pregnancy or post-surgery, or you have pelvic floor prolapse or urinary or fecal incontinence where things sort of slip out, all these are indicators that pelvic floor dysfunction could be present. And pelvicrehab.com is an area you can, or a website you can go to find a therapist in your area. Okay, so then fourth and finally, we come to disrupted gut-brain connectivity. And going back to the conversation on the podcast from a few months back with Dr. Alex Ford at the University of Leeds, he was sharing what I really appreciated, this more contemporary view of irritable bowel syndrome, which can include constipation, being viewed as a gut-brain disorder and not just a gut disorder. So there is clearly an impact between the brain and the gut. And this is why some data, as one example, a 2022 observational study found that 75% of people with constipation reported childhood trauma. Now, this is observational data, so it might be partially susceptible to recall bias and group selection bias, but nevertheless, quoting here, early life events and PTSD, post-traumatic stress disorder, are prevalent in patients with constipation. So there does seem to be something between the gut and the brain, which makes complete sense because the brain regulates functions throughout the body, including the gut. Now, the gut also does have its own localized nervous system called the enteric nervous system, but nevertheless, you want both nervous systems, the one in your brain and the one in your gut, to be working effectively. It's also then probably not surprising that people will report stress flares their gut. For some people, it flares diarrhea. For some people, it flares constipation. But nevertheless, it tells us that some sort of brain-directed therapy can be helpful for these people. This is where time in nature, aiming for 2 hours per week, meditation, or cognitive behavioral therapy have all been shown to be effective, either for the symptoms of IBS, and this is where most of the research is, and in some cases for constipation or irregularity. Okay, so then in recap, I know we've covered a lot. Insufficiency. You want to make sure you have adequate water, adequate fiber, adequate movement. Overgrowth of bacteria. This is where low FODMAP, probiotics, herbal antimicrobials, MSM, the elemental diet, and precalipride may be helpful. Structural, abdominal massage and biofeedback therapy. And gut-brain, time in nature, meditation, and cognitive behavioral therapy are all things to consider. I also just want to quickly say there are a few warning signs that may indicate you want to see a doctor. Very dark or bloody stools, vomiting, severe abdominal pain or low back pain, and also unexplained weight loss. So keep these things in mind if you're also having constipation, and then consider following up with a healthcare professional. Okay, I'll leave you with this quote. Smooth seas do not make a skillful sailor. So if you are having a hard time with your gut health, remember that this is going to increase your level of skill with how to care for yourself and improve your health. And that really is, in a weird way, a blessing, because now you learn what you have to do to be healthy. I do hope this helps you get regular, both with quick relief strategies and then causative measures. And if you need help, whenever you need help, please feel free to reach out to the clinic. This is really at the core of what we do. This is why I do what I do and we do what we do, because I've suffered with health challenges myself. And the relief I've obtained from healthcare providers and researchers has literally changed my life. And so if we can help you along your path, we are always here as a resource to help. Please comment if you wouldn't mind. Let me know what you think, and I will talk to you guys next time.